Good evening, viewers. Hope you all are doing truly well, as I always ask you. Today is a special occasion, and we are celebrating that on the True Wealth Integrative Health TV with the discussing a major topic of health of the girl child. And what an auspicious occasion to address this topic, but the International Girl Child Day, and some of us parents are really proud, and a lot of mothers are really proud to have daughters in their life. And however, the journey is not as easy as it seems. And while it's not as easy as it seems, we are here today. Myself, Rajashree Gadgil, and I have another esteemed speaker and good friend with me, Dr. Rajalaxmi Walavalkar with me, and I'd like to introduce her, of course, and have her on the virtual stage with me. So, Dr. Rajalaxmi Walavalkar, welcome on the show, and give me the privilege of introducing you, of course. She's a very senior gynecologist. I wouldn't call her old. She's senior but not old. And she's highly skilled IVF specialist at the Cocoon Fertility, one of India's leading chain of IVF centers catering to infertility and related conditions. She has an extensive experience in reproductive medicine and has trained in India and later, of course, in UK. Her career of academic distinction spans over 21 years. She's MRCOG and has a consultant certification training from the esteemed Royal College of Obstetricians and Gynecologists in London. She's founder chair of the RCOG India Liaison Group of the RCOG. She's UK and has she's previously served on the RCOG Congress Committee and the Indian steering group of the college, where she was involved in many academic exchange programs between the two countries. But moreover, Dr. Rajalaxmi does a huge amount of work in the gynecology segment and reproductive health and much more. She's going to tell us about. She has been doing. She has published a lot of scientific papers and many rewards actually to her name, which includes Times Power Women Award to leading IVF Consultant Award, many to her name. And brief introduction, of course, of me. I'm Rajashree Gadgil, nutrition expert, founder, and CEO of TRUWELLTH, of course. And with 20 years of global experience in nutrition formulations, continuing medical education, I have a master's in science from the Science Hospital and an MBA in marketing as well. I have globally worked with coveted organizations, and my career encompasses therapy areas like orthopedics, therapeutic nutrition, gynecology, gastroenterology, cardiodiabetes, pediatrics, and more. I firmly believe that nutrition as a therapy can be modern day's most effective and safe truth in so many elements, and especially on the topic that we are discussing today. So, lifestyle and autoimmune diseases is something where nutrition plays a key role. While I will be talking about nutrition, moreover, but we are going to really address a lot of these key issues which a lot of moms will identify with us. We keep having wanting to know these issues. Even children, or the girl child, needs to know a lot about it. So while we have already done 300 more plus programs on True Wealth Health TV and with 1,000 plus faculty, and we have reached more than a million viewers, we are very proud to celebrate today's International Girl Child Day with Dr. Rajalaxmi Walavalkar. Dr. Rajalaxmi, I would of course want you to speak a little bit before we actually go ahead with all those questions that we always keep having in our minds, and we of course want to address them here today.
So, for starters, thank you very much for having me on this show. Um, so, when you talk about a girl child, I know it's a topic very close to both our hearts because we both of us have daughters almost the same age, and as they grow up, uh, you know, um, I'm so often reminded of the ABBA song "Slipping Through My Fingers." And it just, every passing minute that you see them grow up. And as a gynec, yes, there are like issues that I help mothers deal with. There are like counseling sessions, etc., that happen. But as a mother, seeing those changes happen in your own child and knowing that, she's going to grow up one day, and knowing that both in our in our jobs as mothers, to start with, and our jobs as a gynec and your job as a nutritionist, I think, we need to create women who are going to be good mothers in themselves, not only in the social sense of it, not only in the responsibility sense of it, but in the health sense of it. Because if we are going to be able to concentrate on our girls at this point of time and make sure that they do have a good foundation for their health, um, they are that much more healthier to look after their next generation, and that's how it needs to be passed on. And that's like my tuppence worth of why I was really thrilled to be here today. I think this is a very, very topical, a topic that needs to be discussed more about. And I'm sure mothers who are watching us today are going to have a lot of questions. And hopefully, through our discussion, we should be able to at least answer a few of them.
Well, totally true. And you were actually even more keen than me when I just discussed this idea with you. And we all talk about these days. There is a lot of awareness. So, puberty is a word which isn't stayed as much taboo as earlier. Besides, a lot of us didn't even know. Probably as children, we didn't even know what puberty was. So puberty and menstruation is now nowadays a topic which is also discussed in media a lot. So we do know about it, but of course, in the scientific and the right sense, we would like to know from you what puberty really means, and what is menstruation and how are they different, and what really happens. How what is that we need to know really before one gets it.
Okay, so an easy way of explaining this would be, if you have puberty as the whole picture, menstruation is a little part of that picture. Okay, so menstruation is one of the events that happens as a girl is achieving her puberty, and puberty is necessarily the journey from being a child to being a fully formed adult. And this journey is going to involve physical changes. It is going to involve hormonal changes from a medical point of view. It is going to involve maturing as a person, development of emotional quotient, development of social skills, and everything put together. So what takes an individual, either it's a girl or a boy, from being a child to being a fully grown adult, to be able to adjust into the society and take added responsibility. That entire journey is puberty. From a medical point of view, puberty would be, those changes that we see. So maybe it starts with, a little bit of hair growth in the armpits or the pubic area. Maybe the breast buds developing, and then the breast going, further. A little bit of changing in the shape, because now that the hormones are starting to act, there is going to be fat deposition in different areas, as a child is going to grow, and finally culminating into the ovaries maturing, the ovaries responding to the commands from the brain, and allowing for the ovarian cycle to happen, so that a period of menstruation starts. So I'm going to try and simplify this for people to understand exactly what happens. So when a child is small, when a girl is small, um, her system, which is supposed to convert her from a child into a mature woman with the capacity to procreate, with the capacity to have her own children, the entire system, the entire hormonal axis is in a quiescence phase. It is quiet. As she starts growing, what then happens is that the first command is from the brain. Okay, so the brain gives out a command which sets into motion a series of hormonal changes. And basically, it is secretion of hormones like FSH, LH, prolactin, secretion of hormones like oxytocin, serotonin, dopamine. So a lot of neurotransmitters and hormones, their sort of equations with each other start changing in the brain. That sends a command chain down to the ovary, asking the ovary, okay, you've been asleep, kindly wake up now, time to start working. This can take anything between a few months or could last even for a few years. So typically when we see in our population, our girls might get menarche as early as 9 years, and some girls might not get menarche until their age of 16. And those are the limits that are accepted medically. Menarche is the onset of the first menstrual cycle. So the first time that a girl bleeds, it's called as the menarche. Now, um, basically, when the ovary receives this command from the brain, it starts slowly waking up and slowly starting to go into the hormonal changes. So the ovary will start producing its own hormones. Um, there are also genetic commands that are set into our genetic code and our epigenetics, which will give the ovary a command to say, okay, time to wake up now. And slowly, the ovary, with the help of the brain hormones and its own hormones, tries to grow a follicle. Okay, and once this follicle grows and the follicle ruptures, the necessary hormonal cycle of the ovary gets completed. Now the ovary has got two functions, not only growth of the follicle and growth and the rupture of the follicle, called as estrogen and progesterone. And estrogen causes the lining of the womb to thicken. Okay, the estrogen in the initial phase, when a small girl, the womb will be very tiny. But if she has to become mature to carry a baby later on, the size of the womb also has to bulk. The lining of the womb also has to start responding. Okay, and basically that so the lining of the womb would start thickening. If a follicle has grown along with this hormonal change and the follicle ruptures, the second command for the progesterone hormone comes in. Okay, and the progesterone hormone now starts stabilizing the lining of the womb. If a pregnancy has happened for somebody, any woman during this cycle, the progesterone will continue rising, not cause a period to come. But if a pregnancy has not happened, then the progesterone hormone will dip after some time and the period will set in, because this lining which is thickened has to shed itself every month. And that is how the period starts. Now, we said that the period cycle could start as early as 9 years in some girls and as late as 16 years in some girls. So basically, why does this happen? That is going to be one of the questions. I know we've discussed this in the afternoon, so I'm just going to preempt that question. So why would some girls get their periods happening early, and why would some girls have their period happening a little later? So one of the main factors, so there are like two factors that we need to consider for this. Factor one is going to be um, the girl's own physiology, okay, and the girl's own genetic makeup and the type of hormonal responses that she is scheduled to have. The other factor is going to be nutritional factor. Okay, so if a girl is destined to have a period early because of the way that her hormonal commands are going, there could be a genetic link to this. It's maybe somebody else in her family also had a similar picture and they had a period earlier, so she might get a period a little earlier. And it might basically be because of that. Hello,
Yes. Uh,
hello.
yeah,
Yeah,
we are
sorry.
able to hear you.
I think my
No,
screen froze here for a second.
no, I think the connection was a
Okay,
little.
and
Yeah,
at the
yeah. Go ahead. Yeah.
yeah, the connection was a little wonky. And those are the factors that might get somebody to have a period a little earlier. Some girls will get a period later purely because that is what the genetic makeup is, or they would get a period later because of certain nutritional issues. So if a girl tends to be anemic, the body is going to try and save her hemoglobin. The body doesn't want her to bleed. So girls who are having a poor nutritional status might, with a similar setup compared to some other girls, start their periods a little later than somebody else. But at any given point of time, if a girl's periods are starting earlier than, say, 8 years, or by 16 years the periods have not started, or by the age of 10 years if you have not seen development of the secondary sexual characters. So, change in the shape of the face, change in the body, the breast bud developing, the hair developing in the armpits or in the pubic area, then that's a red flag. Or if the changes, so if they happen earlier than about 8.5 years, but if they have not started to happen until the age of 16, irrespective of whether period has happened or not, that again becomes a red flag. So these are the two things that mothers need to be aware of. That if the girl starts showing changes too early, then that is something for which they need to be approaching a doctor.
Great. So I think, yeah, those were all my questions to ask you. If you know what happens, and if it happens early, and what are, of course, the changes that happen in the body itself. While we and this is something you will be able to answer even better, because how do moms, especially, a lot of times this responsibility stays on the mother even today, that she has to communicate all this to the girl child. And how does she really go ahead telling it to her? Is, of course, everyone has to be creative about it, but what's your suggestion? How do we prepare? A lot of times this is the age when it's pre-teen or teen, when children are anyways, because of the hormones trying to, they are transforming, in terms of their emotions, and there's a whole lot of change happening. So how do we deal with this change? Is there some sort of a preparation, or should we build, speak with the child beforehand, so that they understand that this change is going to happen?
Hello, yeah.
Yeah,
So that's actually a very important question, because every mother needs to get her girl prepared at some point of time.
yeah,
Because you do not want the girl not knowing what's going to happen, suddenly being on the playground or having gone for a sleepover with somebody, and her period starting. That can be very, very traumatic. She'll get scared. She will not know what is happening.
yeah.
I think having a great bond with your child will really help, because that will allow them to ask you questions which you might be able to answer. And that is like, the first step. If that is not happening, if there's a mother who's been very strict, and yes, some mothers do need to be strict for, whatever reasons, kids don't listen, and whatever um,
Yep.
situation is so, it is very important that you actually sit the child down and point out the changes that the child is going through. So if you sit in a slow way, talking about maybe breast develop, changes between her body and your own body, bring in the question of bras a little bit. From there, talk about the hair growth development. The child might have noticed pubic hair, and that's something that might be scaring the child, because that's an area where she's not noticed hair before. Then, discussing why those hair would grow and why those hair are important, because they do have a function of they do have a function of protecting against infections and stuff. So, things like that. So explaining all that, and also explaining that these changes are something which are extremely normal. The changes that are something that every woman goes through at some point of time, and that these are welcome changes. These are welcome purely because it is a mark that the girl is going to be transforming from a child now into an adult woman. And also bringing in the fact that, you know now that you're growing up, we could be more of friends rather than being mother daughter. Sometimes mother might find it very difficult to broach these topics. And in that case, maybe if there is an aunt that the kids are close to, or sometimes, mothers do bring their daughters even to us to our clinic,
Correct.
just because it is very difficult for a mother to use words like uterus, womb, or vagina, because mothers themselves feel shy. Because if you come from an orthodox family, This is something which might not have been openly discussed with. And it is not only what changes are happening, but the care and the hygiene that needs to be taken care of along with it. So when you sit down to have this discussion and you have managed to broach the questions of the the topics of what a period is, why does it start? It is purely because your hormone system is getting mature. We want the hormone system to mature because with that maturity also it's going to help with our growth. There are like ways of explaining that. And uh, at that point of time, explaining to them that this bleeding that happens, there are going to be hygiene considerations to it. So if you are bleeding, then what is a pad, and why should a pad be changed regularly? Risk of infections if you don't change the pad regularly. That sometimes when blood stays there for a little while, it could have a smell. That smell is also normal because the girls can get scared of the smell. And then
Yep.
when they're not having periods, between the non-period days, some girls might get a little bit of white discharge, but that's purely because their estrogen levels tend to be nicer. So if you tend to have slightly higher estrogen levels, girls could get that discharge, and that's also completely normal. So explaining all these things one by one, maybe not at a single sitting because that might be too much for a child to take in, but maybe breaking it down into small bits, explaining to her, saying that okay, go think about this, come back and we'll discuss this further. Look, one other thing that's like changing with the society now is that girls are getting periods earlier, and even within friend circles discussions do happen.
Yes.
There are also, I mean, unfortunately, for the last 2 years, mothers whose girls have touched puberty might have had a slightly difficult task. But otherwise, schools in fifth standards, sixth standards would, have physical education lecture or a class where even the counselor in the school might sometimes discuss. The other thing that happens is that typically, if it's seventh standard, they will learn the reproductive system, even if it's the plant reproductive system. you know um, the
Yep.
concept that there are going to be two gametes, there's going to be an egg and there's going to be a male gamete out there, and how the pollen has to be taken from one place to the other. And using similes might make it a little less scary for the girl. And then introducing the topic like that. So the way in a female flower the stigma will accept the pollen would go down, and that's how the seed forms and that's how the fruit forms. Giving probably that example as a simile, saying that something very similar happens in humans also. And the way that the seed of a plant is carried inside a fruit, the baby gets carried inside the womb. And literally, probably even taking help of line diagrams that you might get on Google, and literally showing them what a womb looks like, what ovaries look like, what tubes look like, that might actually help them.
True. Well, few points which you actually very. I mean, I would like to highlight them. Of course, all that you told us is really good information. But like you said, having a good bond with your child is extremely important. Taking them to the gynecologist if need be is also a very good idea. And before they sort of come to know from here and there and right and wrong information, it's actually a better idea to educate them. We may end up educating them a little early, but we're always worried that we'll educate them ahead of time. But at times it's better that they're educated ahead of time instead of not being educated at all,
Absolutely.
and they're getting wrong feeds from other places. Yeah, it has been a tough time through the pandemic, especially for kids who have had their puberty, because this is really the time period. I mean, at least for girls, between 10 to 14 is the growth spurt, time where they'll actually develop, for into a beautiful woman for the future. And these are the times where we are really locked in. And here, that's why I would like to highlight a few points on nutrition, because that again becomes very important. Nutrition and fitness, sort of staying at home, becomes extremely difficult and important. And no matter what, all of us are facing it. It's quite different staying at home and still having a fitness regimen. But allow me to actually share a few quick I do have a few good-looking slides, so I think that sort of takes attention. And these are some points which you did touch upon. So one thing is we have to understand that we are a genotype. What is around us, which is the environment that we are in right now is a tough one. Kids are still not out of the houses very easily. Even if they're going out, they're going out very with a lot of restrictions. And so really, what you see is the environment can't change. The gene definitely, cannot change, just like that. So we have to understand that, if certain changes are happening in our children, somewhere it is, it is going to be because of the genes. The other thing is also what they inherit from us. So, we ourselves, first of all, need to have a good lifestyle for them to have one. Plus, they will also imbibe what we are doing. So, when it comes to nutrition and lifestyle, it is really what they are imbibing from us. What we do is what they are going to really do. So really, in these three parameters, what can really change is nutrition, and fourthly, which is fitness. But of course, we all know that it is 70%, or rather almost 80% of nutrition, and 20 to 30% of the workout that we do. And it's not either or. Even if you have nutrition, you have to work out, and they are not replaceable by each other. So this is something which I don't know how many of we all know that we have to focus on, but diligently we have to be disciplined about it. Another thing which I'm observing, and I'm sure Dr. Rajalaxmi, you're seeing it in the women patients and especially girls these days, is nutrition, exercise, and then sleep. Sleep has become a very big issue for everyone in the family. So it's become a issue for children as well. As long as there are haywire hours of sleeping is of course a big concern. It has to be corrected. But apart from that, also getting good amount of sleep and getting good quality of sleep is equally very important. So at times, I would say, do not sweat if you didn't sleep on time. But as long as you get a good quality sleep right now, that's extremely very important in these time periods. So with that, of course, performance, energy, vitality, that all relies on this. So these are basics, and what I would say, that's why we should be focusing on is, like you said, visiting a gynecologist early. There's nothing, no, nothing. There's no harm. It's going preventive, finding out what is going on with us and what we should be ready for. And having a personalized nutrition plan is always extremely good for everyone. Nutrition plans cannot be the same for they can't be paper diets which can be one size fits all. So you have to design a diet which will work for your child. Every mother has an issue that my daughter doesn't eat this, doesn't do that. So, all that has to be taken into consideration while you're designing a plan. And then you need healthy nutrition habits, weight management, muscle and bone building is something we all talk about. Bone building, we never talk about muscle building in case of women especially. And this is the question I'm going to throw at you, of course. But and weight training, this is something which is completely taboo when it comes to girls. We're told, don't build your muscles, then your muscles will show and you won't look like a woman. That's another complete myth which people have to come out. So all these things are extremely important pointers we are trying to actually discuss here today. And the bit where psychological strength and health, wellness, I would say, is extremely important for us to build in our girl child. This is along with the nutrition and the understanding that we are learning from Dr. Raj Lakshmi today out here. We have to understand that we have to build confidence in our girl child, and that's extremely important because probably for generations we've seen our mothers working, but not everyone's mothers have worked, or maybe our generation also everyone's not working. So for the child, but the newer generation is not going to stay at home. They're all getting educated equally. They're going to go out. How are we going to prepare them for all this? So that is extremely important, along with what Dr. Rajlakshmi and I practice in our everyday practice is counseling and trying to give, not just giving the scientific, medical, and nutritional advice, but also building that confidence to be on your own and manage your health on your own as well. So we all talk about having a healthy plate, and this is not happening in case of children today. especially when they're in the adolescent age, there's maximum malnutrition at this point in time. And with malnutrition, we are seeing obesity. So, what does that mean? I mean, malnutrition and obesity. So, the point is, malnutrition means you're not having the right nutrients, we have deficiencies. All those have to be, those can be corrected if we have a healthy plate every day. If your child is finicky, there are different methods by which you can still complete the plate. So that's what we are here for, and we can obviously give you suggestions. The other thing which I guess a lot of us, when we talk about balance of food, do not take into consideration that there's something like a balance between alkaline and acidic foods. And this is very important, especially I think when at this age where where girls gain puberty and inflammation can be an issue, which can, of course, Dr. Rajalaxmi will tell us about the different diseases that are occurring today. For that, I guess a balance of alkaline and acidic foods has to be there. So while we are concentrating a lot on our proteins to be eaten, we have to understand that all of that is acidic. So we have to neutralize it with good number of vegetables and fruits. And we should also, we have to understand fats, starches, sugars, and neutrals. But which of those you should be eating? That is another good question mark. And I'm going to go to that, obviously. A few more slides I want to highlight, and then we'll go back to more critical questions with Dr. Rajlakshmi. Is we talk about having proteins, but then we have to understand why proteins are really needed in the body. Proteins are actually needed for building bones, of course, largely, bones, muscles, and energy. So proteins really are such great building blocks for our growing children, and during puberty they're extremely important because they give us bone, muscle, energy, but along with that, hormonal balances. The hormonal balance can happen because we shouldn't fall short of the amino acids that our proteins are going to give us. So that's what is going to actually help us build the hormones in the right way and keep the right balance. Keep good enzymes, which will help us digest what we eat well. And antibodies, we are all talking about today how to safeguard our children. So look at it why proteins are important. Do not try to find out how much protein, which protein is important, but which amino acid is equally more important than seeing those flashy ads and taking the protein. So understand which proteins have to be taken and why they should be taken. And I always keep talking about proteins to be taken from different sources. If unfortunately you're vegetarians, you don't have the non-vegetarian option, but we should consume non-vegetarian proteins also. And chicken primarily has it, fish also has it. Red meat I would keep off it, but dairy and plant. Again, there has to be a mix of all these three. So dairy, of course, in loads kids can have. Don't shy, don't while you're eating cheese, try to keep it low fat, but let kids have yogurt, milk, cheese, and supplements. Yes, I'm a big fan of protein supplements when it comes to kids, but choose your protein supplements wisely, because the protein, I call them flavoring agents, are not the proteins actually. So find out which will actually help in that growth. So you need isoleucine, leucine, valine, and I think I have it on the slide. Is isoleucine, leucine, valine, glutamine, arginine. These are the amino acids we should focus on. And while we are focusing on them, understand they are going to give us energy. They're going to help us build bone, muscle, and immunocompetence, of course, and give the most important thing, which is important during puberty, is the hormonal balance. So understand that, and while you're choosing a protein supplements or while you're eating a protein, it's very important to get the right. You have to correct any micronutrient deficiencies. So vitamin, minerals, if you're falling short of, you should complement them because they are very important for the uptake of whatever we eat. If we don't have these in the right concentrations, and if we are falling short of it, vitamin D, we all are falling short of it. If we don't take it in enough quantity, we won't be able to uptake calcium. So there are similarly many more vitamins. I'm sure we are going to do more sessions where we will go more details with all this. I have said that we should take it. Kids need enzymes. So eating raw fruits, vegetables, and different sources of enzymes. If not, give them supplements. A lot of the kids have this issue that there isn't good uptake of nutrients. So focus on these things, and we'll go over to this where I'm going to have questions for you. Is what I spoke about weight training, and if you have to build for the future, we have to eat enough calcium. We have to build more bone today. Is when at the puberty, if you eat good amount of calcium, good minerals, and good amount of proteins, that's going to last you when you get your menopause. So women, when they get all the trouble in menopause with calcium deficiencies and bone issues like osteoporosis, we all have to start with our children early. Today it's like a bank balance. Start building it today, and it's going to last us as a saving till late. So same goes with the muscles. I think this is a question, Dr. Rajashree. Keep talking about. There are pointers which are put them saying need and want, and let's discuss this because I'd like to know your input on this because everyone keeps talking about girls should not build muscles, not needed. We have to stay lean and slim and size zero. What's your advice on this?
So for me, whenever you know what I you could basically call it a Barbie culture. Okay,
Yes.
there is like one form which girls feel obliged to fit into, and to do that, they will cut down on their foods. They will not eat.
Yes.
They would eat like sparrows and end up having a million nutritional deficiencies, not only spoiling their reproductive years, because if you don't have good good reserves, good stores in your body for all those micronutrients and all those vitamins and all that energy that you need to be able to do your functions correctly, then you are not able to pass it on to your child when the child is in uterus. The child is born with those deficiencies. And what you do by not taking care of your health at this minute is cause subsequent generations to become weaker and weaker. And
Absolutely
with
right.
that weakness, you also predispose them to higher risk of diseases. Let us just take example of iron. I love this example because it's easier for people to understand because a lot gets talked about iron. So you have your typical girl who doesn't want to eat. She'll eat very little amounts. Supplementation is not something which families have thought about because they feel, okay, she looks nice, she looks thin, she looks very attractive, and girls are supposed to be nice and thin and pretty looking, so on and so forth.
Yeah.
So even parents wouldn't force them to eat much. Some mothers could be at the other end. They might think that the child is like, too thin and try and overfeed her. And that's another group that we also might need to touch upon. But having said that, when you have these girls who voluntarily not take care of their nutrition, one of the things that you would start getting is that they would start having lower and lower hemoglobin levels. Now, the lower their hemoglobin level is, because they have low iron, they have low hemoglobin. The minute the hemoglobin goes down, the oxygen carrying capacity of the blood goes down. Oxygen is something which is vitally required for each and every cell of the body to function. And therefore, so suppose if we ask you to hold your mouth and your nose and not breathe for a few minutes, within a minute or so you start getting breathless and you want to breathe. Now, by reducing your iron, reducing the oxygen carrying capacity of your hemoglobin, you are making all the cells of your body go into an oxygen starved state. The body will keep compensating until a point it goes into chronic fatigue, it goes into exhaustion. On top of that, if you pick up an infection, you absolutely have no capacity to fight that infection because your cells are already that much weaker. And that's just iron. And when you don't eat properly, when you don't take care of yourself, okay, you are not only getting deficient in iron, but you're getting deficient in a list of million things. And probably, Rashi, you're better to enumerate them than I am, because being a nutritionist, I think you look at every aspect of every micronutrient that like needs to be replaced. Having said that, let's now come to protein, something very very close to my heart. Okay, people need to really understand that in your body, okay, the process of new cells being formed and the cells aging and the cells dying continuously keeps happening. When you're growing and you're younger, more new cells are formed and less cells are dying. Okay, this cell cycle of new cells forming and old cells dying has to be there, because when something becomes old, it cannot function as well, and if the body has to stay healthy, these new cells have to be formed. Now, what are cells formed of? Okay, now all of us, even if mothers have done arts or commerce or whatever, your kids might now be having science in school. Science 101. The basic unit of a cell, you have a nucleus, you have those structures around the nucleus, you have your mitochondria, you have your cell wall. Now, we know that for every part of this cell to function properly, each of these organelles has to function properly. Let us only take the cell wall. The cell wall needs protein. Let's take a look at your nuclear membrane. That needs protein. Let's take a look at your cytoplasm. That has got protein moieties in it. Let's take a look at the vacuoles that are going to grab food from outside and bring them inside the cell. Okay, they need proteins. Now, if you are going to be protein deficient, if you're not going to, and if you're not going to be taking a protein-rich diet, you are now causing poorer and poorer quality cells being formed. Okay, that brings me to exercise and protein replacement. So your muscles are your biggest sources of protein. Okay, if you do not have a good muscle mass, a lot of things go wonky. Okay, muscles are needed because the muscles will burn whatever extra calories that you are, if you want to burn calories, you need muscles. Okay, nutrition is very important. Nutrition is very important because you need to have the right amount of calories going in, but if you tend to have excess to what your body needed, that also needs to be burnt off. And even for bodily functions, the necessary calories that you're taking also need to be burnt, and that energy has to be supplied. Muscles do about 80 to 90% of your work here. And therefore, if you have a really thin girl, it's great if you're thin. Okay, but it's also great if you're my size. As long as you have got healthy muscles, and your muscles are there to take you through your nutrition breakdown and supply that energy for your body. Some people say, okay, don't build muscles because you'll become a little manly and stuff, but it's not about building muscles, it's about toning them. And toning muscles, so doing a little bit of weight training and toning muscles, making having them in a good shape, having that might give you a better body shape than having muscles which are untoned. And therefore, depending on what your body's capacity is. Now, to be able to weight train and stuff, your like skeleton has to have that capacity to take that brunt, and that's where your like bone development comes. So if you have not been concentrating on your bone development, your skeleton and your muscles are not going to be able to support each other. Okay, and then whatever exercising you want to do, that also might not happen properly. So muscles are vitally important as far as creating energy for your body is concerned, as far as keeping your metabolism in shape is concerned. The muscles also have got an important function in cellular respiration of your body. And for that reason also, you need to have a decent amount of muscle mass. And that is where I sort of and especially if you're a growing child, you have to achieve your growth. To be able to achieve your growth, you need those muscles for that activity. And not only your skeletal muscles, but also your smooth muscles and other muscles also. So basically, protein supplements becomes vitally important for a growing child.
Absolutely. So, yeah, you did dissect it to the level of cells, and how important they are, and when it comes to reproduction as well, till that stage and further, cells, you are actually talking about the micro part of your body, and it's everywhere. So that's where really proteins work, and I'm glad you thrown more light on this topic. We have, in fact, a lot to actually be addressed. I mean, I'm going to take a few more questions that we could address today, and then I'm sure we'll have to continue with the series because these are topics which we have to keep doing more and more talks and discussions on, and spreading more and more awareness about, because like you rightly said, this is going to affect so many more next generations to come, the current generation and the next generation. And we are seeing the amount of the increase in the diseases that is occurring here. One more important point when it comes to nutrition I was going to mention is hydration. That's another issue. Um, Kids don't eat good amount of fruits and vegetables. Find out those right fruits and vegetables that they like. At least try to make sure that you find good antioxidants in it for them, good amount of fiber in it for them, and hydration. These days, especially when kids are at home, they do not drink enough water. Even when they go to school, they just have one water bottle with them. So hydration is a big issue, and it can be a big issue if that can set off inflammation in your body, and that's where we can have this ruckus happening for the in terms of their reproductive capabilities, and that's fertility, etc., for the future. So having said that, could you
Rajni,
also,
before you go ahead,
yeah,
I know you are doing the question asking today, but I'm going to ask you a question
yeah,
instead.
go ahead.
Um, okay, so my question to you is this: even as a doctor, I sit there and I like talk about hydration, and as a nutritionist, you talk about hydration. Can you highlight hydration in general for people? Things like, does it have to be water? Can it be something else? And how
Yeah,
much amount to drink? I mean, if you look at me, you might probably say to me, you drink 3 liters, but somebody else, you might say, okay, 1.5 is enough.
yeah.
So when you talk hydration to somebody, how do you quantify it for that individual?
So, I unfortunately don't have the urine chart actually in front of me right now, but there's no harm in looking at it. It doesn't look fancy, but we still have to look at it, and we have to be watchful about our kids. And I won't be shy, but at times I'll end up doing this, and I'll point out to my daughter and say that yeah, your urine's looking dark. You're not having enough water. So, that's the easiest marker that you can find out that you're not having enough water. So, you need to increase your water intake. But having said that, about 2 to 2.5 liters of water is good. If you are doing too much of sports activity or during summers, I think it's safer to have another additional half a liter of water. So, make sure the intelligent part that you can do with hydration is even in schools when you're sending your children to school, give them two water bottles. In one, you give them water, and the other, probably give them, you could give them a good hydration supplement, which is actually ideal to do. But otherwise, you can give them a good fruit juice, or I would even recommend amla and kokum sharbats that we have. They are extremely good. They can keep acidity levels at bay. They can help in digestion, and vitamin C. So it does have good amount of antioxidants as well. But like you asked, I'm glad you asked that question, because with hydration, I recommend that we have good amount of electrolytes that go with it, because that can actually hold up enough water in our body that we need. So and do not have anything in excess, because again, these are salts which should not, there's an equilibrium that needs to be there. So having it under an RDA levels, that is your recommended daily allowance, that should be under that. But take electrolytes, and if you can, have a vitamin supplement along with it, and which is why we have even designed one which has vitamin, minerals, antioxidants in it, an extremely good supplement for kids, and it's safe for them to have it. It's better than just having regular water. If they do not, if if they finish their water bottle, then the supplement comes handy. So I would recommend this anytime, and especially now that they are out of COVID, we are all at risk, and we are going out, staying less hydrated, which you again said, to the cellular level. If our cells are not getting the hydration, the possibility of we get contesting an infection, or even the infection getting severe, increases. So stay hydrated. This is why I raised this point today, and that slide was really related to that. I think we will also address the carb and fat issues in the coming forth programs that we do. But I would definitely want to end the program by getting a small gist from you, so that in our coming up programs we can address the complications also, that any sort of lifestyle diseases that we are at risk, or the kids girl child is at risk today, and what we should be careful about. And subsequently, I would request you to come and talk about those disease states at length as well.
So, one of the biggest things that worries me from a gynec and a fertility point of view
Yes.
is a triad of three things. Okay.
Okay.
What I see happening in the community is that I see a rise in polycystic ovarian disease, okay, which we know is a vicious circle, where you have abnormal hormones, you have abnormality with your sugar balance, and you have abnormality with your fat balance, and that again feeds into abnormality with your hormone. And
Correct.
this vicious circle is something that, if we have a specific look at how we are eating and what we are eating, we could try and cut it before the cycle becomes vicious. Now, if somebody has a tendency to PCO, somebody is going to develop PCO. We cannot become them non-PCO. But if we start early on, we may be in a position to have checks in place that the offshoots from that PCO cycle don't happen. And by the offshoots, I'm majorly worried about diabetes,
Yes.
type 2 diabetes, and the entire milieu that comes with it. Okay, so type 2 diabetes is not only going to make you diabetic and the sequelae of diabetes. So, diabetes is one disease that affects you from cell to brain.
Yep.
Okay, that is, so every cell in your body, diabetes is going to be, in the long run, if not kept under control, is going to affect you. Name a system and it's going to affect you. It's going to increase your risk of heart attacks, it is going to increase your risk of infertility, it is going to increase your risk of bone problems, it's going to increase your risk of even dementia, it's going to increase your risk of kidney problems. You name a system and diabetes is going to hit it at some point of time. Your vision, I mean, you're like hearing, and that is how bad diabetes is.
Yep.
And this type 2 diabetes could actually be an offshoot from your PCO cycle. And
Right.
therefore, if you have checks in place early on, right now, when these girls are converting from a child to a young adult, if you start thinking about it, if there is a family history of PCO, you start thinking about it, meet your gynec, you get them to have a good nutritionist on board, and you try and plan a lifestyle. You don't have to be strict with these kids, but as long as you have a sensible thing to follow, that Papa, have, make like healthier choices. um and so that's like one thing. So you're like PCO, you're like obesity and diabetes, and like those offshoots that happen with your nutritional problems. Your malnutrition, you know girls might look really chubby and really nice, but they might be horribly malnourished. They could be calorie deficient, they could be vitamin deficient, they could be micronutrient deficient. In fact, they might look a little rounder and they might be depositing more fat because they're deficient in all these things. The body has gone into a starvation mode,
Correct.
causing you to look fat, whereas you are actually suffering from being malnourished. And that is something that people need to understand. So nutrition is not only about, so that girl looks fat, a mother might think I need to reduce her food so that she needs to thin down, because a thin person is what the society ideally wants, and that might be counterproductive in that small number of cases. And that is also something that like needs to be looked at very, very critically. And lastly, and most importantly, we are also seeing the risk of early ovarian aging, and
Yep.
that also comes from extremely pure nutrition. Okay, so as it is, as a race, the Indians have a lesser ovarian reserve, have lesser fertility as compared to Caucasians. Now people would laugh at me if I make that statement, because we are today 1.4 billion, and nobody would believe that Indians have got lesser fertility. But what I mean by lesser fertility is that a 40-year-old white woman is more likely to have a child through treatment or naturally, as opposed to a 40-year-old Indian woman. A Indian woman will lose her fertility early, and one of the bases out here. Okay, so she might be genetically programmed, but what has she been eating in early life? Has she been taking, altered foods? Has there been adulterants? Has that had a knock-on effect onto our ovaries? These are things that people need to look at. It's not about our generation. It is about generations to come. If we have to have a healthy human race that is going to continue for maybe a few more billions, years ahead,
Yes,
we really need to take stock of the naturalness of things.
yes,
And that is what I would like to sum up. That it is like, not only about today, but it is about your future 100 generations, that you need to lay the foundations for today.
yeah. Well, completely, you are to the point, that, and here I would actually like to add to what you said that, which is why I keep saying that we need an integrative and personalized approach to things. Like we all probably go and have a quick check on our yearly we probably need to start doing it early with our children as well. We should go once you know you're a girl child. It's really very necessary to go to a gynecologist. Also, it is like you said right now, how much role nutrition plays, and that is why it's so much important to leave yourself to a well trained one and who understands it, and instead of just trying anything and everything at home and just believing that you're doing it right, try to figure out what is the right plan for your child, and what is the right plan today and tomorrow differs. So make sure that he doesn't stay malnourished, and doesn't at the same time doesn't stay obese. And where I say need and want, they want to be slim, but in that process they shouldn't be malnourished, and they shouldn't go obese, of course. And there are very easy methods by which you could keep them under control. Once things go out of control and hormones set in, then it becomes even more difficult. So yeah, it's better before that you have to go for hormonal treatments later on, and Dr. Rajalaxmi knows what I'm talking about, and I'm sure we'll throw light more about the hormones and hormone therapies as we speak in more programs. So it's very important that we take a integrative and personalized advice from both the gynec and the nutrition fitness expert, because it's very critical to actually find out different multiple parameters, like accurate diagnosis, treatment, mind, body, emotions, lifestyle. All these things we just verbally say, but they have so much deeper meaning, and along with it a personalized nutrition plan, which includes the child's needs, preferences, tolerability, compliance. All this we take into consideration when we make a plan, and we are sure that the child will actually follow it. And a holistic approach can actually help us, finally improving the reproductive health. And it's not only just for fighting the disease condition, but like Dr. Rajashree said, that it's for preventing ailments and improving the health of the offsprings and the generations to come. So these were really the critical points, and we have to understand that the onus is not only on the doctors and the nutrition experts, or the integrative experts, but it is really on the parents, and it's also the parents trying to make their children understand by what you rightly said, that have a good bonding with them and trying to explain to them the right things at the right time. And that's very very important for this generation and the generations to come. And I think this was a very important session we had for mothers. I know we quick planned it, but it was such an incredible time. It's always incredible time spent with you, Dr. Rajlakshmi, and
Same here,
so much
Rajni.
more that I take home when I listen into you. And with I take the promise that we are going to continue with more number of such education sessions for the girl child, of course, which we are very
Passionate about.
passionate, and we're so fond about. So I think I'd thank you for coming here and having this
Absolute pleasure being here.
session with me, and I'll thank the viewers for coming here and watching it. I know we've come back after some time, but our shows are going to go back again in action as we all are probably getting back into the regular mode. And let's keep our fingers crossed that we're not hit with the third wave, and things will get back to normal for all of us. Take care, Dr. Rajalaxmi Walavalkar, unless you want to say something in the end.
Yes,
But I would like
absolutely.
to thank.
It was a pleasure to share screen space with you as usual. And thank you for having me. And I'm really glad that we could bring out so many important points for mothers to action and think about.
Thank you, and thank you everyone, and have a good night, and we'll be back with you soon. I'm going to play the a quick uh, video of course, RSG Energia, who keeps supporting us through these programs. And I would like to also thank Mahesh Darade and his team for always keeping the helping us, sharing flyers and information so that it reaches maximum number of people.